Hi everyone, this is Dr. Harrington. We are going to have 4 modules for med students and other trainees to talk about hospice care. These are meant to be very practical and kind of a 30,000 foot view. So this first one, we are going to talk about what is hospice and how is it different from palliative care. The second module will be who isn't eligible for enrollment and how do you refer a patient to hospice. The third will be how hospice is paid for and what services are included. And then the fourth module will be frequently asked questions. These are questions that families will almost always ask you and how to answer them. All right, so let's get started. So what's the difference between palliative care and hospice? Hopefully you guys have already done the intro to palliative care, and so you know what palliative care is, but we will go over that quickly. Palliative care is specialized medical care for patients with serious illness. It's a type of care that's focused on providing patients with relief from the symptoms, pain, and stress of serious illness, whatever the diagnosis. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a team of doctors, nurses, and other specialists who work with the patient's other doctors to provide an extra layer of support. Palliative care is appropriate at any age and at any stage in serious illness. Can be initiated at any point in the patient's illness. It's independent of prognosis and can be provided alongside curative care. Now, at the end of life, it may be the sole focus of care, and we do that a lot through the services of hospice. So this should look familiar to you guys. This is a model of integrated care. So time is on the x-axis, clinical focus is on the y, and you've got a patient who's diagnosed with a life-limiting illness. Early in the disease course, absolutely most of the focus should be on disease-modifying treatment, but at least a small portion should be on providing excellent palliative care for the patient and the family. So this is providing good pain and symptom management, taking care of the whole patient, making sure psychosocial, emotional, spiritual needs are met. As that disease progresses, the palliative piece will become greater and the aggressive curative piece may become less. When we're at this phase of a patient's illness, we're at the terminal phase of a patient's illness, usually in the last 6 months of life. That's when we start talking about bringing in hospice care to provide essential services near the end of life. And those do include bereavement support, so we'll talk a little bit about that too. So hospice is a program of palliative and supportive services provided both in the home and in inpatient settings for patients with weeks or months to live, so they may live as fully and comfortably as possible. Again, we are really talking about hospice care when the physician thinks the patient has less than 6 months to live. This is another model just to show you where hospice fits in modern medicine. And here's palliative medicine. So you can see that all of hospice is palliative, not all palliative is necessarily hospice, if that makes sense. So a little history. Hospice has been around in the United States since about 1974. It's been in other countries a lot longer, places like England and Ireland. Looking at the latest statistics, the National Hospice and Palliative Care Organization puts statistics out about every 4 years. These are 2018 statistics. The US has a little over 4,500 Medicare-approved hospice programs. In the year 2018, about 1.5 million people received hospice services, which accounted for about 1/3 of all deaths in the US. Median length of service, and when we talk about length of service, we're talking about it time from enrollment to death. Median length of service is about 24 days in the US. About a third enroll in the last 7 days of life. So about a third of patients enroll in hospice in the last week of life. About 40% enroll in the last 2 weeks of life. I had some earlier data. I couldn't find the 2018 data for this, but earlier data shows that about 10% of patients enroll in the last day of life. So hospice is a really a great service that patients are eligible for in the last 6 months of life. You can see that a general pattern is that patients enroll very, very late in the disease course. So some diagnoses, about 30% of patients enrolled in hospice have a cancer diagnosis, with 70% having a non-cancer diagnosis. So you can see the top three non-cancer diagnoses are heart disease, dementia, including Alzheimer's, and end-stage lung disease. I can tell you that, 20 years ago, these were flip-flopped, where it was mostly cancer patients, and less common were non-cancer. So that pattern has changed. Some more statistics for patients enrolled in hospice. The majority die in their place of residence. So that can be a patient's home or the nursing home. About 11% die in an inpatient hospice facility. So this is a facility where patients can get around-the-clock hospice care that's outside of their home. And then some hospitals have designated hospice beds within the hospital, and that accounts for less than 10%. So this is kind of how it breaks down, but the majority of patients are going to die in their home or in the nursing home who have hospice care. All right, so that just lends me to my next slide. Where can hospice be delivered? So one of the things I hear all the time is the patient's going to hospice like it's a place, but that's really a very minority of patients actually go to an inpatient hospice facility. Most of the time, patients will receive hospice care and hospice services in their home. Hospice can also be provided in a nursing home or a long-term care facility. So not only will patients get the basic care that the nursing home provides, the hospice actually provides an extra layer of support and care for those patients. Again, we talked about an inpatient facility. This is where a minority of patients will go in and they can get around-the-clock hospice care. And then there are some hospitals with designated general inpatient hospice beds. Okay, so we will wrap this up. So just remember that palliative care can be provided anywhere in the spectrum of a patient's illness. Hospice care is a way to provide palliative care in the terminal phase of a patient's illness, usually in the last 6 months of life. It can be provided in a patient's home or in the nursing home or in an inpatient facility or in designated beds in a hospital. All right, that will be it for Module 1. Thank you very much.